Today we are going to discuss about BPCC 103, that is Psychology of Individual Differences, and Block 1. In Block 1 we had discussed Unit 1. Today we are going to discuss about Unit 2. So basically just brief about the BPCC 103. It has 5 blocks, and like in several units. In unit 1, personality and individual differences, which we are going to discuss today. One part we have discussed in our last class, and unit 2, that is assessment of personality, which is we are going to discuss today only. Unit 3, concepts of intelligence and emotional intelligence, and the theories of intelligence, which we are going to discuss in our next class. And unit 5 is assessment of intelligence, aptitude concepts and measurement, differences between Indian and Western psychology, concepts of self and Indian thoughts, motivation, creativity. See, all these units will be covered within 5 to 6 classes. So let us see what is personality assessment. So before understanding personality assessment, we have to first understand what is assessment. So So, what is assessment? Psychological assessment is a scientific and standardized method of drawing conclusion about aspects of of an individual, such as motives, social traits, attitude, adjustment, interest, etc. So, it is a basically scientific and standardized method of drawing conclusion about anyone, about his motives, personality traits, attitude, adjustment, psychopathology, etc. It fulfills the essential criteria of being a reliable and valid measure. So it's like very much reliable, like anyone can use it and they will find the more or less same results. So valid means that it has assessed the things which the psychologists want to assess. So that is validity. It helps to describe, explain, and predict human behavior. So you can administer this test and then you can describe, explain, and predict about the human behavior. It helps in decision making and also providing guidance and counseling. So suppose if you want to provide a counseling, so before providing counseling, you should you have some material in your hand. So those material, those information will come through various types of assessments. Okay. So let us see what are the characteristics of psychological assessments. So psychological assessments are comprehensive and holistic. It's not like just one piece or one part or one aspect is seen. It assesses the person as a whole. So that's why it's like very comprehensive and holistic, and psychologists require intensive training for learning these psychological assessments. So all the relevant aspects need to be taken into account, integrating all aspects of the individual's life. If suppose if you find one aspect is very much dominant, so but you have to see this aspect of the life in, in relation with other aspects of his life. Then all psychological assessments are systematic. It's not like done in a haphazard manner. There is a system, like it is systematic process, and you have to follow those process ongoing. So psychological assessment is not a one time activity. uh, it is an ongoing process. So, like once you have assessed and you think it's over, no, it's like ongoing process. So sometimes we have to repeat the assessment to see if there is any change in the particular thing. Sometimes we do the assessment to see that if there is a change in psychopathology due to intervention, psychopathology reduced, or due to some stressor, psychopathology is increased. We have to see the sometimes improvement in terms of intervention, so we assess the effectiveness of intervention also. So that's why this is an ongoing process. accurate. So this is the very important characteristics of psychological assessment, because the reliability and validity must be ensured. You cannot just frame some questions and ask and then you say that the person is like that. No, the questionnaire, the way you are doing assessment, it must be reliable and valid. So reliability and validity must be ensured of any psychological assessment. Then confidentiality. We all know that in psychology, when we talk about the any person about his problem or any his issues, concerns, so no one shares the such personal things until unless the confidentiality is maintained. So this is the most important characteristics of this assessment. You have to maintain the confidentiality, otherwise you will not get the desired result. The person may not give you the actual responses, rather the person will become guarded or may distort the response or give social desirable answers. So that's why this is the job of psychologists, counselors, to maintain the confidentiality. So let us see, is there any difference between psychological assessment and test? So a psychological test is essentially an objective and a standardized measure of a sample behavior. It is an objective tool of assessment. It is a standardized measure or tool. It provides uniform ways of administration, test instruction, and scoring. So there is a difference between psychological assessment and test. Psychological assessment is an umbrella term under which psychological test is there. So psychological assessment may include just clinical interview, just observation, and some other like participant observation or some history taking, record collecting. All these things may come under psychological test, mental status examination. All these things come under psychological assessment. Under psychological test, all the reliable and standardized tools, for example, MMPI, Big Depression Inventory, 16 Personality Factor Questionnaire, Straight Rate Anxiety Inventory. So all these inventory questionnaires, scales are reliable and standardized. Okay. So psychological assessment refers to a broad evaluation of the individual. It may include psychological testing, surveys, observation, interview, history, and demographic information of the client or patient. Psychological assessment is used by psychologists for assessing the behavior, attitude, personality, and drawing conclusion about it. So it means psychological assessment includes psychological tests. Okay, so in psychological assessment, some of the techniques, for example, observation, interview, history taking, might be having some amount of less reliability. So they may be, because it depends upon the skill of the interviewer. If the interviewer is skilled, the reliability of interview will be high. If the interviewer is not skilled, not trained, so the whatever information the interviewer got about the person, it may not be a reliable or valid information. So establishing reliability of the interview, history taking, observation, surveys is very important. So that's why lots of training is required. At least like in our country, 2 years structured training program is there, which is called MPhil in clinical psychology. So, so let us see what are the properties of a good test. So you all are using one or different tests. Uh, so let us see which test we should select. So if the test like the So we should know about the qualities or properties of the good test. So we should select only good tests, not just where the reliability is less or not a standardized test. We should not select. So standardization refers to uniformity in administration of the test and scoring and interpretation of the test responses. It means if we call a test a standardized test, it means there is a manual. In manual, it will be written like how to administer this test, what type of instruction given to the client for answering the questions or doing the test, how to score. There is a set pattern. You cannot deviate your way of scoring, and interpretation. Based on the scoring, there is an interpretation. So everything is standardized. There is no scope to deviate. Only thing counselor require or psychologist require is to train himself or herself or to develop certain skills so the test can be administered. So it must be administered on a standardized manner, and the test must be standardized. So if the test is not standardized, please do not select those tests for administration in your project or in predicting any behavior of the person. Norms. Okay. So what is norms? Norms refers to the scores obtained by the representative sample on which the test was developed initially. So suppose you have administered back depression inventory and you got the score of suppose 20. So what does it mean? So if you say the score is 20, no one understand. So you have to say that. So according to norms, the score 20 means mild depression, okay, or moderate depression or severe depression. So all these things are based on the norms. Same way, if you are using intelligence test, for example, second form board test. So you have given the test to the client has done, you have noted down the time, and on the basis of minimum time, you are seeing the how much IQ this person is having. So there is a norm table. So norms are available. If the test doesn't have any norms, it means the test is not useful. You cannot interpret the findings of those tests. So the test must be standardized and the test should have norms. So then reliability, you all know that it like without a reliable test, it is not useful. So reliability refers to the consistency of the scores obtained by an individual on a test. It means if you are using this test on a person today and after some time, for example, after 2 3 months, so the test should be the score should be same. Or if you have used this test on a person, if another person is using on the same person, if another psychologist is using again after some time, so all should give the same result. So if the result are more or less same, it means the test is reliable. Okay. So reliability is very important because if reliability changes with the administrator, so then it will be very difficult to accept the test. So reliability means how many times you repeat the test or whomsoever is repeating the test, the findings should be more or less same. Validity. Validity refers to how well a test measure what it intends to measure. For example, you have developed a or your teacher has developed an IQ assessment test, intelligence test. Okay, and the test claims that it gives intelligence of the person. And if you have administered the test on on a student of class 12th who got around 90% marks in 10th, and his performance is consistently very good, and the test finding gives you IQ score of 85, which is below average. So, can you accept the test findings? No. It means the test doesn't measure the IQ. The test doesn't measure the intelligence. It measures something else also. So that's why the findings are different. So validity means, for example, if you have thermometer, it must be checking your temperature. If it doesn't check your temperature, if it takes your your blood pressure or something else, so it means we should say that this is not a valid tool to assess temperature. Same way, if the intelligence test which doesn't corroborate with the intellectual performance of the person, we should say that the test is not valid. So the test may be reliable but may not be valid. So validity is the must. But without reliability, uh, validity doesn't make much importance. So both the things, validity and reliability, is the basic quality of any test. Then norms and standardized test must be there. Now let us discuss about the ethics of psychological assessment. So who can use psychological test? Any person who is trained in using this test, it can use the psychological test. So training means any standardized way of giving, recognized way of giving training. For example, if you go and learn some test from your friend, from your teacher somewhere, so it you cannot claim that you are trained. You must done some course which which is equivalent or which consisted of training in administration of the test. Okay. For example, if you have done post graduation in clinical psychology, so in psychology there is a tests are part of their training, but still you cannot use on a patients. After getting training, you can use this test on a normal population. You can do this test on a research purpose. Okay, because uh, dealing with the different projective techniques and other tests, you need intensive training. Without intensive training, tests should not be administered. Just for learning purpose, for academic purpose, the training got in a classroom setup can be used. There is no harm for uh, giving training to the students in classroom setup, but using on a public may require intensive training. Otherwise, the findings may be misinterpreted. So, psychological assessment should be done by a trained psychologist only, and psychological tests can be done with intensive training. It is unethical to use a psychological test without having a formal degree and training of the same. Okay, suppose a person who has done MS in history, MA in history, or PhD in history, and got training from some psychologist in using this. So, can he use the test? No, cannot use. It is just for the learning purpose, just for the academic purpose. He cannot use such test on anyone. He cannot claim that he has got training until unless he has done undergone some course. So, informed consent. The client should be briefed about the intent and use of the test before conduction of any psychological test. It means without informing the client or without getting consent, you are not supposed to administer this test on any of your patient or client. So it must be clearly said. Okay, so training is required, formal degree, under that degree only the training is considered, And then informed consent is very much. So these are the ethics. And suppose if you don't know about some test, and you have to include in the test of a particular client, so you call another expert, another trained person to administer that test. So as I told you, confidentiality is the basic thing. Without confidentiality, you cannot, you should not use any test. You should maintain, and it is very easy to maintain the confidentiality. You keep the record with you. You never discuss with others until unless the person is your supervisor. No need to disclose the personal identification of the person, so no one can identify. Okay, so it is very simple to maintain the confidentiality. And if you meet the person in a public place, no need to initiate the interaction until unless the person starts. Report the report the findings of the assessment in an unbiased way. So we all know that we are having prejudices, biases, and we have to work on that. So if you are working on the biases, so we know that what type of biases we are having. So while interpreting the scores, we should be unbiased. We should just follow the manual. What is written in the manual, we should follow it. No need to distort the findings or scores in any circumstances, whatever pressure you are having. It is also important to be aware of the test taking situation and the ethnic and cultural background of the test takers or clients, as these may affect the test results. So, like when you are using an intelligence test on a boy, 10 years old boy who is from a rural background, who came to visit some problem in a city, so you should be very cautious about using certain test, or first make the child familiar with the test, or you should be well aware about the culture, religion of the client. So these all things are related to the psychological assessment and tests. Now coming to the main topic, personality assessment, its uses. So see, if you are not aware about the any psychological tests or psychological assessment, it will be difficult for understanding the personality assessment. So let us see the um, what is personality assessment, since you have already understood what is psychological assessment. So where it can be used, so personality assessment has been used in schools and educational setup, and it's like used in career decision for career counseling, clinical use to diagnose psychological disorders and formulating better treatment plans, industrial and organizational context, sports and military setting. So in a school and educational setup, sometimes we need to use intelligence test, sometimes we need to use personality test. For career decision, we need to study the aptitude and certain skills. For diagnosing a psychological disorder, we need mainly projective test or certain personality tests. And industrial organizational context, we need this aptitude as well as interest, motivation, and other related organizational skills which require to mm, doing doing the best in the organization. And sports and military setting, like how to manage the stress, how to combat the stress, how to be relaxed in a particular situation, how to behave in a certain situation. So all these things are uh, having psychological images. So what are the methods of personality assessments? So there are two methods, direct methods and indirect methods. Direct methods includes observation, interviews, personality inventories, and or questionnaires, Rating skills, behavioral data, situational test. Indirect methods include projective tests. So, so basically, uh, like direct methods are easy to administer because norms are there, instructions are written, tables are there. Whatever score you got, you just convert the score and you get the findings. So direct methods are very easy to administer, and scoring is also sometimes very easy, and interpretation is also based on the manual. So less skill is required. Whereas in direct methods, very much intensive training is required. So projective tests cannot be done without intensive training and under supervision. Like many, like in MA level classes, okay, in MA program, there are projective techniques which you have to study. So for academic purpose, you have learned the test, you know that how to administer, how to score, how to interpret, but this is not sufficient to use this test on a public. Just for learning purpose, it's okay. Same way in other courses, for example, MD in psychiatry, people they also study projective techniques, but they do not fulfill the requirement of administration of this test on patients. Why? Because they have to do at least 25 to 50 such tests under supervision with by a trained person. Then only they can claim that they can use this test. So if you see the manual of thematic perception test, it's clearly written at least 25 assessment you should do under supervision on a various clients. Then only you can claim that you are trained. So we are discussing about the academic purpose. So we should know, being the psychologist or doing graduation in psychologist, you should know what are the tests, what are the direct method, what are the projective techniques, and you should know what are these tests, how to administer, how to score. But this is only for academic purpose. So let us see the observational method, which is very important method in understanding personality. So what do we do in observational method? The person is directly observed in different situation. Like if you want to see or study the behavior of a child, so you are observing the child in a school, you are observing the child in playground, you are observing the child is in house, okay, in his home. So in 4 5 situations you are observing the child. But as I told you, it is not possible for a psychologist to observe like this. And sometimes it's not feasible to move around and constantly observe the person in different situations. So observation is possible in school setup, or when the child is in any custodial care, or when a person is admitted in a hospital. So there only the observation is possible. In other situation, we are dependent on the others report, like parents reports, teachers report, friends reports, colleagues report, like that. So during the observation, the psychologist makes an effort not to disturb the natural condition of the client. So it means if you are observing, so the client should not be very much aware about this observation. So there are two types of observation: participant and non-participant observation. A participant observation method is where the psychologist become a part of the group under observation. Like sometimes the group member they do not know that the person is observing them, but he is part of the group. And sometimes it's like the psychologist create groups of someone, then observe and then study and then publish the data. In non-participant observation method, it's also like naturalistic observation method, where the team members they do not know that if someone is there to observe it. In this psychology does not seek to participate as a group member, rather observes the client or group from a distance to note down the observations about the client. So it has been seen that non-participant observation in some condition is more useful than participant observation, because when the psychologist participates, the other members they become aware, so they modify their behavior according to the social situation. So what are the limitations of observation methods? There are two limitations: observers bias and observer effect. So, if like as I told you, we all have lots of biases, prejudices. So sometimes, like it may be based on the uh, our economic background, our social religious background, so caste, culture, so many things are there, gender. So all these things may color the observation, so the findings may not be reliable. So that's why to overcome these limitations, intensive training is required uh, in this method. Another technique is interview. You might be doing interview with so many persons, like in your subject, in your practical, or if you are working somewhere. So if you are hiring someone, so or if you are talking to someone, if you are convincing someone. So basically, what is interview? So asking questions to the person or interview about his or her behavior is basically interview. So your purpose is to understand the person. Suppose you are interviewing for a person to for a particular job, so you have to see that the person is suitable for that job or not. So that's why you will ask certain questions related to that job, to that person. So you will get idea about the person. So same way, like when you pass the exam or when you do practical exam, so many questions were asked from the students. So, like the teacher asked so many questions related to this, your course, related to your syllabus, related to that particular practical, to understand that how much you have understood about the concept or about the how much you are how much you have understood this syllabus, or how much you have studied, how much you have gained the knowledge, how much you have gained the skills. So all these things must be assessed by the teachers or examiners. So on that basis, the examiner can give marks. So there are two types of mainly, or three types you can say, interview. So one is structured interview where there is a less scope to deviate from the questions. Questions are well written and you have to ask only those questions in a particular order. So we call it structured interview. Semi-structured interview allows the psychologist to ask specific and detailed questions as and when required based on the need. So there is some freedom. And in an unstructured interview, one question leads to another, and a large pool of information can be collected from the client to explore about the life events and behavior of the client. So, see, for structured interview, you need little bit training. For semi-structured interview, you need little more training. For an unstructured interview, you need very intensive training. Okay. So, what are the limitations of these interviewing technique or methods? So, it's same thing as observation, like bias of interpretation. You may interpret in your pre-decided mood and other things. The halo effect, interviewer subjectivity, lacks reliability and validity. It's time consuming and not easy to take the interview in some of the condition. So there are lots of limitations, but all these limitations can be overcome with intensive training. Then there are personality. inventories, which are called objective personality assessment or direct personality assessment. So questionnaires or scales that consists of questions or statements are called questionnaires. The individual or test takers needs to answer these in a specific standardized format, and these tests are called paper and pencil test or self reports. So basically, what happens? There are certain questions. So for each question, there will be an answer yes or no. Sometimes on a liker type scales, for example, I strongly agree, I agree, undecided, I do not agree, I not agree at all. So this is like 5 point Likert scale. So most of the personality inventories are either on a Likert based scale or true, false, or yes or no type of thing. So the questions are printed on a paper sheet, and this subject or patient has to client has to tick one of the answer given. So there are various personality inventories used in psychology. The oldest one is Minnesota Multiphasic Personality Inventory (MMPI). There are several versions. Another one which is used in our country more, and now it is very much in used in Milan multi-axial, Milan clinical multi-axial inventory (MCMI). So it's very easy to diagnose a person, to comment about the personality trait or certain conditions on the basis of these questionnaires. But MMPI is a very lengthy, more than 560 items, whereas MCMI is having just 175 items, easy to administer. However, you need intensive training for scoring and interpretation, because there are different ways and complex way of scoring and interpretation. There is a computer version is also available. Then another one is 16 personality factor questionnaire, 16PF we call it in short, and it is given by Raymond B. Kettle. So Kettle has given 16 factors of the personality, which we had discussed in our last class, and they are on a um, pole. For example, introvert or extrovert. This is not there, like less intelligence or more intelligence. So the client's score will fall within 1 to 10, and 4, 5, 6 is considered as average, and deviation like less than 4 score, less than 6 more than 6 scores considered as a presence of that particular uh, factor in the personality factor in that person. Another one is NEOPI, uh, Myers-Briggs type indicator, then California Psychological Inventory, Eigen Personality Questionnaire, Edwards Personal Preference Schedule. So, like some of this Eigen Personality Questionnaire is very much used in our country, and it has like again on a poll like introvert, extrovert, and neuroticism, psychoticism, and life scale. So MMPI latest version of it consists of MMPI 2, and it consists of 567 true false items. It has 10 scales and 4 validity scales, and used for assessing the likelihood of psychological disorders in the individual. So it gives about the, like you can make the diagnosis of schizophrenia, um, then paranoia, then psychopathic deviation, then depression, OCD, like that you can make the diagnosis. The new modified version is Minnesota Multiphasic Personality Inventory to restructured form to RF. It was developed in 2008 and consists of 338 true false items. The MMPI-A has been developed specifically for the adolescents with 478 items and the provision of age-appropriate norms. California Psychological Inventory (CPI) has been specifically developed for normal adult population, and the recent version of CPI is the third edition consisting of 434 true-false items and 20 scales, a short form of CPI having 260 items. Neuroticism, extraversion, openness, personality, inventory, revised, new PI. Uh, it is given by Costa and McCrae and based on five factor model of personality. Do you remember five factors model of personality, which acronym is OCEAN? Openness, O for openness, C for consensusness, E for extraversion, A for agreeableness, and for neuroticism. So it is based on that model. And NeoPA is used with normal population, both adults as well as adolescents. And there are 6 subscales called facet under each of the 5 dimensions. And the scale has a total 240 items. 16 personality factor questionnaire, 16 PF. It was developed by British psychologist Carter and is based on 16 source traits of personality. It is used for the age group of 16 years and above. These 16 primary traits are on a continuum ranging from one end to the other end of the continuum. So the score will lie within one between one continuum to another continuum. MBTI, it is based on 4 personality dimensions: sensing, intuitions, thinking, feeling, introversion, extroversion, and perceiving or judging. So let us see the limitations of these personality inventories. Like participants may give socially appropriate answer instead of honest answers. So there is a high possibility of getting socially uh, social desirable answers. Suppose the question is, do you tell a lie? The child will think, if I say yes, so people think I am a liar, so I should not tick yes. So the child will tick, no, I do not tell lie. So this shows the social desirability. So their responses may vary because of the cultural influences, and respondent or participant may not answer in a responsible way or sincerely. So sometimes if you administer the questionnaire, you may not find anything related to the client. Then coming to rating scales. So rating scales is basically rating the psychopathology or particular trait of the person in the quantity. It consists of a standardized item that are to be rated on a fixed parameter. Social desirability effect: one acts according to what is desirable by the society. The social desirability effect may also operate in case of personality inventories and even in interview. And if rating is not done honestly, it may result in biased response and also socially desirable response. For example, back depression inventory or back anxiety inventory or Sinha anxiety inventory. So these are the rating scale. So if you give the, like for example, BDI back depression inventory, and the first person, do you feel sad? So I may say yes, I may be feeling sad, but I may think I should not take because people will think I'm depressed. So there are limitations of rating scales. So that's why before before doing any psychological assessment, direct, indirect, using scales or interview or observation, establishing repo is the basic thing. Without established repo, you should not do any psychological test. So behavioral data using a device, it does not require a researcher or psychologist to be present to observe the behavior. Rather, the job is done by a device, for example, video camera. Electronic activated record picks up the auditory information and relates it to their personality traits. So the limitation of this behavioral data using a device is the person may become conscious of the device and will not behave naturally. Situational test. So involving assessing involves assessing the individual in carefully designed situations. The behavior of the individual is observed in a purposefully designed situation, and situational tests of the personality were first used for selection of military personnel for critical overseas assignments during World War II. But the limitation of this test is time consuming, requires more energy and planning. Coming to indirect methods, that, that is projective techniques. So there are various types of projective techniques. Let us see them one by one. In projective tests, the individual responds to unstructured or ambiguous stimuli. So the person may not be aware of the impact of his response or the effect of his response or the consequences of his response. If the person is saying something, what does it actually mean? Because the stimulus is very unstructured or ambiguous. So the individual projects his or her latent or unconscious feeling, needs, emotions, motives, etc. on the ambiguous stimulus. The responses of the individual in the form of projection reflects the nature of his or her personality. So if the stimulus is ambiguous and the person is not aware about the meaning of his behavior or her behavior, so there is a possibility that the person truly respond to that stimuli. There will be no censoring. So let us see the Rorschach test. So there are various types of ink blot tests, like Holzman ink blot test, somatic ink blot test. Rorschach is also one of them. But Rorschach ink blot test is basically called Rorschach psychodiagnostic. So Rorschach psychodiagnostic is given by Hermann Rorschach. So the test is consists of 10 ink blots showing ambiguous visual stimuli. And the score, so the basically there are 10 plates on cards on which the designs are there. So what type of design? If you might have seen the cards. So if you sprinkle some ink on a paper sheet and then fold it, and after that if you open it, there will be symmetrical design. So such type of designs are there in Rorschach cards. The scoring is based on different elements of the responses such as the content, reference to shape, color, part or whole of the image, etc. Scoring and interpretation of the responses is extensive and detailed. So there are 10 cards, and let us little bit discuss about this test. So 10 cards to be shown to the patient, client one by one. And before showing the cards, you have to say that you have to instruct the client that you are going to show some cards. On each card there is a design one by one. On each card there is a design, an ambiguous design, and you explain this phenomena. If you sprinkle or pour ink on a paper sheet, then fold it, open it, there will be some design. Children used to play earlier. So such type of designs are there. Actually, there is nothing in design, but people see many things if they try to see. So whatever you see, you have to tell me. Then show the card to the subject or client and note down the time. So you have to note down the reaction time. Like reaction time is time lapsed between the card shown to the client and the response given by the client. So after showing the card, you just wait, let the client respond. When the client, suppose the client say bad on card one, so you just note down the first reaction time, suppose 10 seconds or 15 seconds. In seconds it should be written. Then note down the bad response. Then again wait for more response. Do not just remove the card. So then after waiting for some time, when the client say, "Ki, I'm not seeing anything," then you remove the card. And it just after telling one response, if the client say, "Yes, I have finished, I have done," so then you repeat the instruction. Ki, many people see many responses, you can see more responses. If you are seeing, you can tell me. So that way you have to encourage, but this encouragement should be done for initial 2 3 cards only. After it, you are not going to encourage the client. And so after getting the response, then again you are showing the card and asking the client, which is called inquiry phase. In inquiry phase, you are asking about the location, which part of the plot seen as the response, that is called the location, and why that response is seen, why that object is seen in the card. For example, bat, why the client has seen the bat. So what are the characteristics of the bat in this card? So the client may tell you. So you have to determine about the determinants of the particular response. So you are finding out the location. Location could be whole plot or the major detail or the minor detail or rare detail. The same way, the determinants of the response could be form or shape or the movement or the color or the shading. So you have to note down. So it is a very some complex, or you need intensive training for this. And then on that basis, you have to score and interpret. Another test is thematic apperception test. So what is a perception? A perception when you respond to any stimuli on the basis of your past experiences and emotions. So in short, it is called perceptions colored with emotions. So, so it is like there are vague pictures, human pictures are there, and this test was developed by Murray and Morgan in 1930, and it is consists of, actually in originally it is consist of 31 cards, 30 cards and one blank card. And so out of 31, you we have to select 21, like on the basis of the gender or the age of the client. Like certain cards are for male, certain cards are for female, certain cards are for boys, certain cards are for girls. So suppose you are administering this test on a male, so you have to select the card for common cards plus those cards only which are having male. So it's written on the card: M for male, B for boy, F for female, G for girl. So you have to accordingly. So after sorting, it may not, in any condition it cannot be more than 21. So there is an Indian adaptation also. The test aims at measuring the motivational traits of the individual as reflected through the stories. Indian adaptation of TAT has been developed by Uma Chaudhary in 1960s. It consists of 14 cards, and you have to select 10 cards on the basis of gender of the person. There are cards for male and female. So in this card, the administration is simple. Like you have to establish repo, show the card one where a child is sitting with piano guitar, and you have to give the instruction that you have to write the story about this picture, and you have to write about the present, what is going on in the picture, why this is going on, means about the past, what happened in the past, so this is going on, and what will happen in the future. uh, so the client has to write and follow all these three instructions. So on that basis, the psychologist or the tester may able to know that what are the needs of the client, what are the defense mechanism client is using, what type of pressures he is having, what type of he does he identify himself or herself with the hero, and what is the outcome of the story. It could be comedy, it could be tragedy, happy ending, such like. So these two tests, Rorschach and TAT, needs very intensive training to perform on anyone. For academic purpose, you must perform this test on your friends, family members. So you should have idea about how to administer. There is a test for children also called children perception test. There are two types of these tests. So in one type, there are animal pictures, and another type, there are human pictures. So the animal picture is very popular in among children and adolescents. So so the cat card uses animal figure instead of human figure as it is meant for children between 3 to 10. So if they are more than 10 years, you can use human figure of CAT. Another projective test is uh, sentence completion test called SSCT. SHAC has given this test. So it consists of statements that are required to be completed by the respondent. And some are so like there are 60 statements, half statements, which subject has to complete. For example, my father was, and then dot dot dot. So the child has to, or the client has to fill. So my father was very loving, or my father was very angry. So it shows the way the thing is completed. It gives you idea about the conflict. So conflict about the family members, conflict about the self, conflict about the mm, guilt feelings, and the performance, and several other things. So it depends upon the how you are choosing the test and administering the test on the person. But these conflicts helps us a lot to understand the person. There are other projective techniques also there, like draw a person test, DAPT, where you give a paper sheet to the client and ask them to draw a picture, draw a person. Then uh, the client has, suppose the client has drawn a male figure, then you ask the client now draw a female figure. So then Rosenberg picture frustration test, where RPFT basically there are pictures. One person is saying something, another person's space is blank. So the client has to fill the person. So let us see the limitations of the projective tests. What are the limitations of these projective techniques? So they subjective in nature because examiners or the psychologist skills are very much required. Otherwise, you cannot administer this test. So, low reliability and validity. If the psychologist is not well trained, the reliability and validity will be zero. It's time consuming. Definitely, especially those art tests. Sometimes the administration of this test may take around 1 hour, but interpretation may take another 2 hours. So 3 4 hours sometimes is required to get the proper report of this test. Then it requires skills and expertise in administration and scoring and interpretation of the projective test. So even though administration requires lots of expertise, if you have not administered it properly, it will not give you the uh, result. So let us sum up. Like today we have discussed about concepts of psychological assessments, personality assessment, its uses, and methods of personality assessment. So thank you. In our next class, we'll discuss about the intelligence.